Welcome back to Medical Missions TV, everyone. We're excited to be at Loma de Luz Mission Hospital. Over the next couple of weeks, we're going to have an opportunity to sit down with a number of the staff and the founders to share a little bit about this facility and what God is doing here. The hospital cares for about 25,000 patients and does about 1,200 surgical procedures each year. Their primary catchment area is about 50,000 people on the northern coast of Honduras, but they receive referrals from physicians, nurses, and public health facilities all around the country. Join us this week as we meet with the hospital founders, Dr. Jeff and Rosanne McKenney, and they share their story of how God called them to Honduras and how Loma de Luz Mission Hospital came into being. If you're here watching, welcome back. I'm here with Dr. Jeff McKenney and his wife Roseanne. They are the founders of Loma de Luz Hospital, where we've been visiting for the last week. And I appreciate you guys coming out to do this and sharing a little bit about your story here, because that's what we want to do, is we want to tell the story of Loma de Luz. And that is really intricately your story. So I'm glad you that you came up here to do this. So we're excited to have you. So Roseanne, maybe you can start by telling us a little bit about your family and that you raised your kids here, and now they're kind of off and grown, right?
Right.
So.
Our oldest child, Nathaniel, is currently in Jackson, Mississippi, working as an engineer with the university there. And he came here when he was 8 years old. And our second child, Gabriel McKenney, is also an engineer, geologic engineer, and he is currently working on working with a company in Honduras as a consultant for water engineering, and he was 6 when he came. And our youngest, Hannah, is a junior in Belmont Nursing School in Nashville, and she was 2 when we came here. And the first years, when I came ready to do homeschooling with my kids, and so that was pretty much I lived in the village, and I took care of my kids with homeschooling, and got to know the teachers. And one day I asked my kids if they wanted to go to school in the village school, and surprisingly, they told me they wanted to try it. So Nate and Gabe both went to the village school when after our first year here, and it was tough. It was really tough, but we learned a lot. I learned a lot about the community, the teachers, the culture, and it really set the stage for where we went from there, because our kids really opened up doors for us in ways that we wouldn't have expected, didn't plan on it, but as an outreach from that, and my daughter also went to kindergarten here, so she also went through what was I think, quite difficult, but they were good sports. And from that, we opened up El Camino, first with a few promising students from the elementary school, and it has developed into a full accredited school that goes from pre-kinder to 6th grade. And that, to me, is probably my greatest source of joy. I went there today just to check out one of the classrooms I was observing, and they sang to me in sign language. This was the 6th grade. They asked real interesting questions about how it started, about how my daughter burned down a house when she was 4. They were really interested in that. It's a cautionary tale.
And it was our house, by the way.
Yeah, it was our house. And then, as I was leaving, they clapped. They were just so excited and happy that we had done this. But additionally, they asked if they could pray. The teacher said, "Who wants to pray?" And like half the class raised their hands, and one little boy prayed a beautiful prayer. But it inspired me. It gave me this sense that, as you get tired and you've done this for a while, I saw in these kids that they're going to maintain the torch, and they're going to bring it to the next generation, and we don't have to do everything. That, to me, watching them share what they've been discipled to do since they were 4 years old, and the changes that they're going to affect in this culture are so beyond what we could do in our lifetime. And that, to me, was like, thank you, Lord. That was a great day.
That's awesome. So you obviously had your share of ups and downs in this place. Uh, can you share a little bit, maybe a little bit about your call to start Loma de Luz and how that all came about?
Your turn.
Oh, I'm on.
Yeah.
Well, my call began with the very general and became more and more specific as my life went along. I came to follow Christ when I was 18 from reading the Bible. Reading the Bible largely with the intention of rejecting it, but giving it a fair hearing, and couldn't get around the person of Christ when I met him in the Gospels. So I became a Christian, but sort of conditionally to the Lord. I said, okay, I'll follow Jesus, but I want you to show me what you want me to do, who you want me to be. And I was very much convinced at that time that the Lord wanted me to be a medical missionary. And I think that was probably his sense of humor of my demanding an answer right then and there, because he I think knew what it would cost, and I had no idea. I didn't even know that I had to go to college to go to medical school, and I had never heard of a residency. And so all of my years of preparation included, wherever I could, visiting, working in mission hospitals and mission medical settings around the world. And I had a pretty convinced plan on paper before we ever set out of what I was called to. In the midst of my 20s, I had a series of dreams of what it would look like, of what the place looked like, and it looked like this. It looked like Loma de Luz. I met Roseanne when I was a surgeon in Italy. I was paying back a scholarship for the Navy at the Navy hospital there, and Roseanne was a civilian nurse, and we met, and we kind of got starry-eyed right off from the beginning, and had our first big fight over, I wanted to be a missionary and she did not. She had grown up as a missionary kid and knew what she was getting into, and I was kind of all dreamy about it. And we decided that we would do this, but do it differently than what she'd seen, and do it differently than it has been done in a lot of mission settings. And my calling became more and more specific as we zeroed in on. Both of us had an affinity toward and some history in Latin countries, and I went back to some of the Latin American countries reviewed or thought of that I'd worked in before. We toured a couple of them, and everywhere we went seemed to be being pointed toward Honduras, where neither of us had ever been. I had no idea even what Honduras looked like, and came here in 1990 on a kind of an exploratory trip to see if Honduras was supposed to be the place. And it became more and more clear that Honduras was, and so we began with the general, yes, missions, and then Latin America, and then Honduras, through staying in motion. You know, the Lord is a light unto our path and a lamp unto our feet, but we don't see very far ahead unless we're moving on that path. And so we kept moving and saw further and more clearly what and where we were supposed to begin a mission hospital and related school and orphanage we had in mind from the beginning. But where was a question that I went to the health ministry of Honduras, and spent a year going back and forth on trips while I was in private practice in the United States, and would return to Honduras for another meeting with the health ministry, and kind of moved my way up through the Ministry of Health with a prepared speech of we have in mind to start a mission hospital and other service-oriented outreach to care for the needs of your poor, but we want to do that in order to share our faith. Are you interested in that? Was the essence of my little speech. And they would all be interested in that. They were all very gracious and supportive. Sure. And then I'd say, okay, where? And they'd say, oh, I can't give permission. You need to talk with my boss. And so I moved up from boss to boss until I finally spoke with the Minister of Health, and prayed with him. And after the prayer, asked him the same question. He asked a couple of, I think, very insightful questions, and he was a good minister of health. And I asked him where, and he said, well, I'm not a career public health official, but so I can't answer that question, but I have people who work for me. And he sent me back down the hall to someone I'd spoken to some months before. And he was expecting me. He said, I figured you'd be back. And I've been thinking about your question as to where, and went over various places that it could be. But his number one recommendation was in the middle of this triangle between Trujillo and Tocoa and La Ceiba. And the very middle of that triangle was this place here. And this place here was the place that Roseanne had seen on a map when we were together a couple of years earlier in Belize, saying, wouldn't it be great if we could go to that place, if the Lord would send us to that place? And it was also the place that looked just like the place on my dreams. But I wanted some affirmation, some direction from working with national authorities. And they sent us here. It fit with what our visions had been all along, fit with what our thoughts had been. And so that's how we got to this particular place. And how we got to this particular property is a similar experience of searching and moving, and the Lord kind of closing this door and then opening a door, almost always after praying with somebody, and led us to Loma de Luz. And we began this work when there was essentially no road, no water, no sewage, no personnel, no labor force. We didn't know anybody in the country. We didn't have any organization. And so we started really from scratch. In those days, it took 3 hours to get from here to Jutiapa, which now takes half an hour on a pretty nice dirt road. It routinely for years took 3 hours if you could get there. So this was a very isolated place in those days, starting kind of from nothing, except starting from the clear direction of the Lord, that he had something that he wanted done here.
Tell me a little bit about the hospital. How many beds? How many patients do you see on a daily basis? Surgeries?
The hospital, the number of beds is not the same kind of comparing apples to apples as you could in, say, comparing it to an American hospital.
Sure.
It's essentially a 50-bed hospital by infrastructure, and we have roughly 30 beds that include, in part, the beds that are now developing in kind of Ronald McDonald kinds of houses, where we've built 13 different houses right next to the hospital, where patients that need medical attention here nearby but don't have to stay inpatient, where we can expand our bed service without having to expand our payroll from the nursing care that's required.
Sure.
So the answer, how many beds are there? 30-something, about 30. What size is it? At least a 50-bed hospital by the kinds of sterilizers, the kinds of power plant, the kinds of generator backup, and the kinds of expertise we have here is for a referral hospital, because we are now a referral hospital for all of Honduras. 85% of our patients come not from our primary catchment area, but from all over the hospital, and they're
All over the country.
referred all over the country. I'm sorry, and are referred here now from the public health hospitals all over the country.
I've noticed
So
that.
it's hard to say how big
Yeah.
is it. It's
By work, by workload.
Yeah.
I think you guys are pretty impressive.
How many we do about 1,200 operations a year. We see about 25,000 outpatients a year, and every year, all of the numbers that have to do with patient care increase by about 30%. So 30%, and then add to that extra 30%, another 30% the next year. So it's growing just a little faster than we can keep up with.
Sure. Well, tell me, you guys have gone through a huge. I mean, this place is amazing, and there'll be other videos kind of overviewing the facility and the place, but so people will be able to see that. But this couldn't have been easy. This had to be really a hard road to get. I mean, obviously the Lord is in this in such a huge way, but I'm sure it wasn't easy. What have been some of your biggest challenges, both maybe personally and professionally, in launching this and getting it to where it is now, and even sustaining it? Because it seems like just such a monster uh, to take care of.
Want to start?
Well, initially, I would think one of the hardest challenges for me was leaving family and friendships and not being able to reconfigure that here.
Yeah.
There's a lot of cultural difference from people that just, didn't have things I could relate with very easily, even though I spoke the language. So I felt pretty alone. Perhaps it's, partly an introvert making friends over a longer period of time. And then the other is that the nature of missions has changed from when my parents were missionaries and stuck to a place for 35 years. The nature of missions has changed so much that now who I came with initially that had small children along with me, they left many years earlier. And so I lost those friendships, and then the next year I would lose more. And that's a real loss when you have something in common, you're kind of in this together, and then you lose them and you become more and more alone. You feel alone because new people don't know it yet, and then maybe you get close and then they leave. So I think for a woman, those are some of the bigger challenges for me. I think initially finances were a big problem, big concern. Meeting payroll for the hospital, it has defined us in many ways, having lived with so little in the beginning and still trying to make things work. I think it developed in us a self-sustaining model early on that, okay, if this is going to cost this, we need to figure out how we can cover it with, the way we manage things. And so I think now we're 18, 20 years down the road in having opened the doors of the hospital, but we're also surprisingly self-sustaining in that the hospital is actually supporting a children's center and all of their staff in addition to the ongoing daily needs of the hospital. This does not include, of course, the missionaries that volunteer their time and their expertise. That is a completely huge thing that the missionaries give. However, I think the early days of want have developed this place to be sustaining, self-sustaining in the way we manage it, which God has really blessed.
What about you, Jeff? What have been your biggest?
I think Roseanne answered the question really well. That the initial burdens, some of them are constant throughout up until today, up to today. But many change as life goes on. Early on, I carried, and for many years, like nearly 20 years, this burden, well, almost 25 years, of I feel charged to see that this happens. I know the Lord's got to make it work, but it's my responsibility, I felt, to pay the bills and find the people and come up with the engineering plans and interface with the government and all of the impossibles that could have been on any day just made this work not work. I always had to come up with a solution for. And most of those, as we have just stuck it out, the Lord has made work. The personnel, I would say that probably the biggest heart blessings and heart hurts have had to do with people, and particularly missionaries in both ways. And people leaving you, and you're the only guy left after a while. That's a difficult thing to deal with. The issues that really never go away is some of your family and some of your friends are still somewhere in a different country. Our children are now grown, and that's another challenge that you meet when, for a while, at least our nuclear family was here, even though you might miss all of those Tuesdays and birthdays and little occasions with your sisters, or be able to take care of your parents as well, or whatever. You come to terms with that, and then your nuclear family is in a different country, and they have needs and problems, and you can't be there right there for them. That never goes away. But I would say that in general, things in many ways, some of the initial challenges have gotten easier. Personal people issues are still the most difficult issues, and probably the biggest blessings.
That's awesome. So what's the future look like for Loma de Luz? What's the vision for the future?
You want to talk about school?
I did talk about
Yeah.
school.
What we can see best is just as far ahead on the path as the lamp shines, and we can see clear growth for the hospital. It continues to grow for the Children's Center, particularly for the school. We add a grade every year. We anticipate and plan for and work for all the way through high school, and then we're have in mind and have had in our hearts for quite a while to build a vocational VOTEC school here for kids getting out of high school, to give opportunities and with it adhering for the Lord to the youth in this area. So continued growth, particularly in education and in healthcare provision. I see the hospital continuing to grow as a referral hospital and the kinds of things that we can manage. And then both of us also are beginning to see in more real terms what we tried to plan for from the outset, is that we both know that we're not going to last forever. We're committed for as long as we can. But nobody lives forever, and we don't want to see this left without the best preparation that we can to see that it continues as the Lord's work here. And so how do we factor in us being gone is something that we're actively working on more and more. But there will be a future of Loma de Luz without us here, one way or the other.
One of the aspects that I think we've learned that goes back to sustainability and then ties into a trade school and training young people that don't have a lot of options in this area is that you need to start businesses in order to train students in these areas that they might want to learn, like welding and a restaurant and teaching language and car mechanics. So these are some of the micro businesses, or businesses I should say, that we are getting involved with. We've started construction on a coffee shop that should be ready in a few months, and that's kind of exciting, both for member care and for the local community, but also for training young people to learn how to serve and how to wait on people. And one of the things that is a little bit farther out, but we're committed to and we have the land for, is a language school. We have a property that's well situated, and somebody gave it to us, and you got to wonder why the Lord did that. And so we've explored the possibility of starting a conference center and a school for people that want to just refresh their Spanish, learn their Spanish. But there would be a component to that which would include housing and tourism, like a hotel with a restaurant, and so that we could train the locals here, the young people, to serve these people that want to learn Spanish again or for the first time. So
awesome.
that's out there.
I think that the vocational school is a good illustration of how do you learn to do this, because I didn't ever find any classes in college or medical school or anywhere else that teach you how. Okay, here's how you build a vocational school in the developing nation, or even a hospital or a school or an orphanage.
Or a coffee shop.
Or a coffee shop. But you strike out with something the Lord puts on your heart and begin to investigate it, talk to people who do know, and make plans and keep in motion. The vocational school, we had researched for 2 or 3 years and had a pretty good idea and thought that it was a good need that we were going to fill. But my idea was that we needed a piece of land and a building and a curriculum and teachers for a vocational school. And then I went and talked to experts in starting vocational schools, and 2 of them that are pretty renowned experts in starting vocational schools, and their first question of each of them was, what kind of business do you have in the area? It wasn't what's your curriculum or what's your building going to look like, or how are you going to interface with the local schools, or all of the things that I had thought of. I hadn't even thought of what's the business like. But as soon as they said it, sure, it makes sense. We need business because in a vocational school, a lot of learning takes place hands-on, and instead of sending them to the city with people that we might know but don't really have that much interface with, or maybe none. If we want a vocational school, it needs to be with businesses here. So you have to start businesses before you can start a vocational school.
And last week we started our first prosthetics.
That's true, yeah.
We started our
One of the
prosthetics
businesses
lab.
is the prosthetics lab. So we now have 4 or 5 either online or coming online of businesses that we've started in this area that will be places for the kids in the vocational school to enter into and apprentice in and learn welding or mechanics or prosthetics or service industry.
You 2 are dangerous. What happens when you put 2 visionaries together?
we would never have imagined some of the
this is
components from
Yeah.
the beginning, but you don't find out unless you keep trying.
That's awesome.
Fail fast, fail often.
Yeah, learn to recognize your failures and lay them down and go in some other direction.
So, from a recruiting perspective, what are your needs right now? I mean, if somebody was to come as your ideal missionary, what would that look like for you guys?
A doctor who would love to teach elementary and take call
And do admin.
and do deliveries at very awful times. No, we could definitely use more help with OB. I think call can sometimes get people, wear them out. But teachers, huge. We need teachers.
That's funny because most people don't think of, the mission hospital model. They don't think, well, where's a teacher going to fit in? And that's been actually a big need for us globally, not just here, but trying to find people to fill spots as teachers on smaller mission compounds where just for homeschool co-ops. And then you guys have a really awesome school. It's a really impressive place. So
our school was started for the local community because we saw the need having our kids in the public schools here. But it turns out that missionaries select where they want to come also based on, do we have a school for them while they work? And so the idea hadn't been initially for the missionaries, but it really serves a fantastic thing. The kids the missionary kids interface with some of the nicest kids out there, with the nicest parents, and they get to play with these great kids, get to know them, have lifelong relationships with them, and help them with their accents and learning English.
Yeah, that's great.
So it's a really a great thing that kind of the Lord made it happen. But we know that missionaries have chosen to come here because we have a school. But the school is very intensive, very labor intensive, requires committed, dedicated teachers working, 4 days a week at least.
And you still are
I would
looking
add in to answer your question before we move on of what kinds of people do we need here. We need lots of, we need different kinds of doctors. We need another general surgeon, an orthopedic surgeon, and an anesthesia provider to help us kind of back off a little bit. But we also need a mechanic. We also need a construction engineer. We also need admin people in a big way. We need childcare workers, people that are called to that. It has so many components, so many facets to Loma de Luz now that if you have a skill, we can probably use it. We need a videographer and a full-time social media person. We need people with business backgrounds, which I didn't realize until some years into the work, that in many ways it was a small business then. It's gotten to be a pretty big business now, and you need business skills to be able to do it well. And the Lord will use, if you've got a skill, I think we can use it here.
That's awesome. Thank you guys for taking time out to do this. We appreciate it.
Yeah,
Our pleasure.
thank you.